Policy Dialogue Network and strategic partner in policy and governance across the big 5 domains: artificial intelligence, joined-up data, genomics and predictive analysis, wearable technologies, and robotics. And we are also joined today by Dr. Chris Agape Aja, who's a medical doctor and global health policy specialist working at the intersection of digital health governance, AI regulation, and health systems reform globally. As Policy Fellow at Imperial College London's Institute of Global Health Innovation, he leads projects that help global health leaders and national ministries of health solve complex problems in digital health governance and healthcare cybersecurity. Previously, he provided technical advisory to the GIZ African Union Office and Africa CDC, where he designed continental digital health governance frameworks. Dr. Aja also leads Polisync, an AI and innovation policy platform, where he leads a team in reviewing AI and digital health governance intelligence for practitioners across over 15 countries. So without further ado, I think let's get started. And please feel free to kind of be as interactive as possible on the chat. Please introduce yourselves, where you're kind of dialing in from, and kind of your background. And we can use this as well as a networking opportunity. So at the beginning of this panel, we'll have questions right at the end for a Q&A session. So if you do have questions throughout the session, please just make a note of it, and we'll come back to you at the end. So to get started, let's start by defining what do we mean by innovation, and what is the potential for digital health to really transform health systems in Africa? So I'll start with Amaka, if you'd like to start on that.
Thank you so much, Mai. Thank you to the Innovation Hub for the opportunity to be here today speaking to potential innovators or people who are already innovating, and people who will be part of that ecosystem that we think we're going to have in a couple of years, maybe sooner than later. I think it's really important to start first by defining innovation. So innovation simplistically means a new method, a new approach, a new product, okay? So it could be a new way of doing something. And for digital health, I think it's very important to state that it's not a magic wand that will address foundational issues, okay? There are different moving blocks when it comes to health systems. Digital health is an enabler. There's still things that need to be done. However, given our context and given the state of our health sectors and health systems generally, there are opportunities for digital health to address certain issues end to end. So from prevention, diagnosis, to actually improving healthcare access, as well as the quality and efficiency of care. And if you look through the continent, the 54 countries, you would see that there's a lot of work already ongoing. So don't feel like we're still starting. It just depends on how you're defining innovation. You have an example of someone from South Africa who had a condition and had to go through long waiting times to access his medicines. And he developed like a digital storage box that enables you to have access to your drugs. It's already there. You just input certain details. You have mHealth that is being used as a way to inform mothers about certain details, prepare them for vaccinations. You have intervention that a drug is the right one to take, whether it's fake, whether it's genuine. You have interventions where people are, the zip line intervention that it's enabling drones to deliver blood supply to rural areas. So in essence, we have issues like workforce shortage. We have a teeming population. We have very limited healthcare services. At the time when you need to get to the hospital, it's too late. We even have health influencers using social media as a way of demystifying health and reducing low health literacy. So I think the potential is endless. However, we just need to think about what the need is. That's the very starting point, rather than following trends. So that's what I would say as a starter.
Thank you so much for sharing that, Amaka. There's so many amazing things already happening that you've mentioned. And I think what you mentioned as well is a lot of this is ongoing. It's not like, these things aren't in existence. They are, but it's about kind of how do we build on that and keep growing from strength to strength. So thank you so much for sharing those examples, Amaka. Chris, same question to you. What do you see as the potential at the moment for digital health innovation in Africa?
Thank you so much, May, and thank you to the Innovate Health Hub for having me. And it's a pleasure to meet you all this afternoon. So I think when we talk about innovation, I think sometimes when you hear some of these buzzwords, digital health innovation, it feels like we use them so often, but it's always helpful to go back to the fundamentals so that it could help lay the foundation to challenge our thinking. So innovation at the fundamental level is a creative idea, right? Basically a creative idea, process, solution, and in this case technology that has been deployed to tackle or solve a problem and create value, new value where there previously was none. So that's just basically what it is. So it's applying ideas, technology, policies, strategy, creatively, intentionally to tackle problems and create new value where they didn't exist before. And when we look at digital health globally as well as on the continent, first of all, Africa is a very prime place for innovation to happen because we have a lot of problems. So innovation does not occur, is often stifled if there are no new challenges to solve. And that's the definition of the progress of humanity or the human race. So we're at a very prime place because we have unique challenges, and that gives room for innovation to thrive within the continent. And Amaka has cited quite a number of innovative ways that digital health is supporting healthcare delivery. And I think that there's so much that digital health can do. One of the key problems that Africa is facing is workforce shortages. We talk about just brain drain or the gaps in having sufficient health workforce to meet the needs of the population. And digital health can come into that. In fact, that was one of the primary use cases when digital health began to become more prominent on the continent in terms of remote services and things like that. And so that's one use case. Now we're entering into AI becoming more of the norm. And that's also another opportunity to leverage the knowledge of our health workers, right? So distance is less becoming a barrier. We can use technology, we can use AI to support some of that. So that's just one easy way. Also, in terms of health communication as well, that remains one of the areas that innovation has an opportunity to play a significant role. We know that because health services are not as widely distributed as they should, there's a lot of health misinformation that is ongoing in the continent, and there's room for innovation to close that gap through platforms. So meeting people where they are, and we see the community model very common, in Africa. A lot of startups that built around communities for nursing mothers, communities for parents, for example, communities for men and things like that. And we're seeing innovation bridging that gap and, bringing people together, be it on an app, on a platform, to be able to just provide general health information that could support them. And Amaka mentioned as well, you were seeing the rise of health influencers. That was take us 7 years back, 10 years back, that was not a thing, but it's becoming more prominent, especially on the continent. I do not know if I've seen a lot of Western creators who position for I've seen, yes, maybe creators who are maybe they are doctors or they are nurses and they talk about their jobs and conditions. But in terms of like having someone who provides broad-based information, I've seen stronger following for creators in that space on the continent. So that's one form of innovation that is addressing a key problem, which is, misinformation as well. She's talked about drones, EMRs, records, things of that sort. So across the whole healthcare spectrum, you look at what are the challenges. People are not able to access care or get to the hospitals in time. There is an innovation platform that is able to provide some of that support. Drugs are not able to get to people in time. One of the health tech companies I was working with, that was the fundamental basis of our model, right? We're aggregating pharmacy networks across Nigeria so that anyone who provides pharmacy services can come to us and we can say, oh, there's a pharmacy just 5 minutes from your house or 10 minutes from your house. And that closed a significant gap within the country, especially for when you think of health insurance providers and even people just generally looking for care. So the possibilities are endless, right? And Africa is a prime place for innovation to grow and thrive. And I believe most of us on this call are players within this space. And maybe that's where we should start, just to say that we are in a great place because all of the challenges give us an opportunity to innovate, to create new solutions, to think creatively about the problems and create new solutions that provide value where there were none previously.
Wonderful. Thank you so much for that really in-depth overview, Chris. I think what you were saying in terms of really addressing Africa's most pressing challenges through innovation, through new and kind of creative ways to really tackle all these challenges that we do see. So thank you both for that really great overview of all the incredible things that are happening on the continent. So I guess now moving on, we can see the opportunities, we can see the immense kind of opportunities in terms of all of these various innovations. But how can really an environment be created that really ensures there's a balance between kind of technological advancement while still ensuring that there are kind of safeguards in place to really protect patients? And so, Chris, I'll start with you now.
All right, thank you for that question. Balance, that's an interesting word. I don't think balance has been achieved anywhere globally when it comes to innovation, digital health, or digital health, innovation and healthcare as a whole. So I won't say aim for balance. I think the first thing is to understand your context, and maybe I'll start from that, is that oftentimes when we've thought about innovation within the African context, we often are judging our metrics based on the examples we see in the West. And so it's like, oh, if the EMRs are operating this way, oh, then, Africa is behind, quote and unquote, because they are not operating the same way. Or, oh, AI is doing this in the US or the UK or EU or what have you. Oh, and it's not doing that in Africa. So Africa is not there. So the first thing is understanding the context where Africa stands, right? And that goes back to the fundamentals of understanding what innovation means. Innovation means you are thinking about a problem in a different way and creating a solution. And so, what that will mean for the African context will be different significantly for what it means for the West. And so, in trying to create an environment where we address both issues at the same time in the sense that we encourage innovation, but we also encourage patient safety, is first of all understanding the African context. And I'll give you a personal example. So I was leading telemedicine just a couple of years back. This was just off COVID 2021, 2022. I wanted to launch a telemedicine platform, right, to support our users, our patients. And the typical trajectory, I mean, if you're on the call, the typical trajectory, and you've worked in the space, the typical trajectory is to develop an app where patients can then meet with a doctor, you can have calls and all of that, and then you provide treatment. However, the basis of our model was to reach underserved communities. So we are talking of informal sector, we are talking of market women, we are talking of traders, people who may not typically have a lot of digital knowledge, right? They may not have very significant digital skills. And so when we started trying the app method of all of that, it just didn't fly because our users who were selling were selling healthcare plans at that time for malaria and typhoid fever at less than $1 per month, right? Just so they can, if you feel you have malaria symptoms, you can go to a pharmacy, get treatment without any extra cost. So that's about 500 naira as at that time. So, but those users, they barely even have smartphones. They barely even understand how an app works to download and all of that. It didn't fly in the context of our users. And then we went back to them and say, okay, what exactly will be helpful? And they were like, WhatsApp. If I can chat with the doctor on WhatsApp or I can just call, that is enough innovation for me. And that just works. And so we switched our whole model and we gave them a toll-free number with which they could call. We gave the number with which they could chat with somebody. And then we put the burden of all of the back end technology on our own end as the organization. And we provided them, just say, okay, call this number. Someone will speak to you and connect you to speak with the doctor. Will get their information, put a treatment plan, direct them to the closest pharmacy where they could find treatment. Now, that sounds very simple, but that was innovation because it was closing a gap for these people and providing access that they needed, right? Of course, all of that was supervised. I was the one supervising the medical care. So I guess I'm the person responsible for ensuring a safe environment. But all of the interactions in terms of how the doctors, the kind of care they were providing, clinically, I was supervising that. Then in terms of the operations, making sure that patients, found the pharmacy close to them, got the treatment that they needed. We had an entire team that was dealing with users. So I gave that example just to help us see how innovation can be simple, but it has to be contextualized. And I think Amaka made that point to say digital is not there are some things that digital can't solve. Digital is building on a system, right? So you have to ensure that whatever solutions we are developing or deploying on the continent is in the light of the system that we have, and we're able to within that system provide the guardrails that are important and safe and helpful to our patients. And that is an evolving journey that is happening across the world. There's nowhere that you will go and they'll say, oh, their digital system is perfect, or they found the best, the perfect balance between safety and innovation. It's always going to be that tussle, because typically what we've seen is that in governance often lags behind innovation. So innovation oftentimes would make the leap, and then governance like, oh, what should we do? What should we do to rein that in? So I think that's the major point. But in terms of broadly, what are some of the areas to think about when you begin innovating? Definitely, you need to think about when you talk about digital, then data just comes in automatically. So definitely data management, data security, patient safety as well. So making sure that whatever is being delivered digitally aligns to patient safety and patient safety requirements. And there's also sensitization. So in the example I gave, the users did not have as much digital knowledge to be able to leverage what we're trying to build. So there's that part of sensitization and understanding, both even for users or developers on the other side. There's so many things I can say, but I'll stop with these three. But that's the fundamental idea. Understand your context. Make sure your innovation is relatable to the people you're trying to serve. Make it and then ensure that within that context, you're ensuring that it is safe and able to meet their needs. And then you reiterate as you go till you find the best solution. Okay, I'll stop there. Thank you.
Thank you so much, Chris. I think there's definitely a lot of food for thought there. And I think we've seen time and time again that kind of copy and paste models just don't work. You have to really understand the local context, what the need is. And I think that is really, really important. So thanks for raising that. And thanks for giving such a great example of WhatsApp, which I think is widely used everywhere. Amaka, Chris has mentioned that very difficult to kind of get the balance right. So if you could kind of touch on that point, and also how can we try to kind of have that balance, I guess, between the technological advancement and protecting patients, if there's anything else that we need to think about.
Yeah, thank you. Chris has given us like a really strong start, especially regarding context. I think I want to paint a picture. So there was a time when you had to go to the bank in person to make any transaction, and once it's weekend and you have an emergency, you can't do anything until Monday. And then some people saw the problem, found a solution, something that might have seemed very simplistic to maybe the Western world. And, the fintech ecosystem kind of grew. So it wasn't a case of the government created like an enabling environment and then fintech blows up. It was like there was a need. And because there was a pressing need, people had to respond. Now, health is a bit different in the sense that people do not choose to be sick, and there's information asymmetry. So people only know as much as they know. And they don't have a choice most of the times. And then the dangerous part of this is sometimes it's a life and death issue. So a mistake you make in your innovation can actually lead to endangering people's lives as much as it can also help in improving lives. So I think most times people think about innovation and responsibility under the shroud of governance as at two ends of a tug, like of a rope, like a tug of war pushing. But if you rethink it as governance actually enabling innovation, in the sense that you're putting in place systems to ensure that you're doing the right thing and that you're protecting the health and livelihood of people, it's a way of kind of revisiting and having a sense of consciousness when you're creating. Now, Chris talked about context, and that's tied to need. I think I emphasized in the beginning, I didn't mention AI for a reason because I'm very worried as to why everybody's trying to AI everything. Everything does not have to be AI. AI is great, but there are foundational structures you need for AI to happen effectively. And even in systems that are advanced, they're still struggling. And AI is advancing it at such a pace that even the creators are kind of worried about their own creation. And so it's not a right approach to jump on trends. But the first step is to ask yourself, what is the need? What is the problem I'm trying to solve? And one way to narrow it down is you might be thinking, oh, we don't know what the need is. Or you might think, oh, African Union and African CDC, they're having a lot of meetings. Believe you me, there are already substantial documentations with data talking about the heat areas, the areas that need addressing, okay? And it might be as simple as something as creating an incubator that tackles jaundice. That could be the solution. It doesn't have to be something flashy, if you get my point. It can be something simple but revolutionary, if that makes any sense. And so we have the Lusaka agenda that outlines some of the priority areas, but that's tied to health financing. Then we have another agenda with 5 pillars that tackles the issues of, pandemic awareness, preparedness, sovereignty of data, and all of that. And one of the key things, one of the key pillars there is digital transformation with a focus on primary health care. So now knowing that primary health care is an area that there is an intent to digitize, as an innovator, you start thinking, what are the problems in primary health care? Because one of the things that you can't run away from is you can create something that nobody would pay for and there is no need. There might be a need, but there is no one to pay for. So there has to be that balance of need, someone who would pay for it. And given that health financing is very tight, there are just so many things that health financing, very limited resources are pursuing. It makes sense to optimize whatever resources you have, be very targeted. And that's why I think Africa just has such a huge opportunity of, if one person gets it right, then there's an opportunity for scale. But if you sit in your room and conjure something and you think that's a problem, you then have a difficulty because it's not a need and no one is going to pay for it. So that's one layer. That's the need, the context layer. Then where I have a bit of my imagination is coming into it is because I've worked in the US and I've worked in the UK. There are there's like an ecosystem. These things do not happen. I think my point is, for a lot of us in Africa, is people who are excited about innovating with little or no enabling environment. So there's like ecosystems, there's funding, resource pots dedicated to people just testing and trying things. So go and do a pilot on wearables. Go and do a pilot on virtual clinics. We're trying to reduce the number of people that are coming to hospitals. Do we have innovators that can experiment? And so we don't have that. And sometimes it worries me that without the ecosystems, we're then creating fragmented innovations that will not talk to each other. So another layer is interoperability, is viability of your solution. Because if you create something that works in Nigeria, let's say in a particular state in Nigeria, it doesn't necessarily mean it will work in other states. So is that pilot? How do people fund it if there is no ecosystem for that? Then on that layer is governance. You can't talk about innovation without talking about governance. And linked to that is data. There's a danger that if the data you use in making your intervention is not representative enough, you're doing more harm than good. How do you get the data? Do we have a very tight data governance structure? Like, for instance, in the UK, we have the GDPR, we have HIPAA in America, we have NAFDAC in Nigeria, but I don't know how to the extent to which the robustness of that. But then I'm even thinking, do we even have a regulation for Africa that all of us are agreeing on, such that if you do an intervention, you don't need to go through different 54 laws and regulations to get it through? And I can assure you that we have like an African Medicine Agency, and we also have some other structures that are talking about these things. The reason why I'm flagging this is not to discourage you or make you feel we're not where we need to be, is to flag the opportunities. Now, fintech is now hot cake, okay? Fintech became so strong in Nigeria in the banking sector with their interventions that they now have branches almost all over Africa. That's when the government that started looking into it. So my point is, do not wait for when it's mature. You miss the window opportunity. So be prepared now. Start asking yourself, where are the gaps? It could be clinical safety, it could be public engagement, it could be the legal aspects. I don't think we have DTAC. We do not have accreditation for products. So we are leaning on foreign guidelines. We do not have an African harmonized guideline that says that this medical device has to be our own CE marking. We don't have it currently. So those are opportunities for you to start thinking about what that would look like, because at the end of the day, that balance that balance is a must. It's not a choice, because we're talking about people's lives here. And I don't know if any person has watched this. I just came across and I have this on my bucket list. There is a Netflix documentary on the bleeding edge talking about the dangers of doing medical devices and digital health interventions too fast. So, as an innovator, I would recommend that you also watch it and have that consciousness as you're innovating, that if you do not do your due diligence, you could be endangering people's lives. But if you put all these things into considerations, you could actually be improving lives. So it's just that balance has to be struck. That's what I would say about that.
Thank you so much, Amaka. I think you've definitely touched on so many areas, the kind of the limited resources, the enabling environment, the ecosystem, and the context piece. You also mentioned the governance, and something that Chris has also raised in terms of you have the innovation, but really the governance part is always kind of lagging behind. So just to kind of touch on that, if you can elaborate a bit more in terms of why is it lagging behind, and what can be done to really ensure that these kind of legal and regulatory frameworks and governance frameworks are really robust and kind of are able to be enforced across the continent? Thanks, Samaka, if you can touch on that.
Okay, so on the legal and regulatory part, the truth is that everyone is grappling with the same issue, because innovations, especially in health, are moving faster than regulations. And so you have different continents and different countries with different approaches. So there are some people whose approach is, let's make it as tight enough so that we don't have any loopholes. For some countries, they are more interested in innovation and their life science and health ecosystem. So they're willing to have that level of risk to enable innovation. So their laws and regulations is 50-50 in that sense. And then you have countries that are just depending on their regulations and laws for medicines. So just to make this clear, there are different aspects of this depending on what scale you are when we talk about digital health. That's why I made that distinction in the beginning. If it's something like M-Health, the regulation might not be that serious. But then when you start increasing it to medical devices, things that are able to enable decision support making are involved in that process, and the risk level starts increasing, then that's when you have like classification. And people make the assumption that because it's an app, it's not a medical device. So software as a medical device is equally a classification. And for what in terms of what we're doing as a continent now, which is a bit unsettling, is that we're just adapting global regulatory framework. So if someone comes to us and tells us it's CE marked, it's FDA approved, we absorb it, okay? And then we have within countries that are tweaking their laws and regulations to adjust. So that's one part of it. The other part of it is data protection and regulation. So you have the very tight ones, the GDPR, to the HIPAAs, to the national guidelines and regulations around the use of data, because embedded in innovation and digital health is data. And there are concerns about data privacy. There are concerns about data security, because like I said, you do not create innovation in vacuum. It's tested with data. In certain instances, some countries are advanced to the point where they're able to use synthetic data. But I think because we have not yet realized the value of our data, we are now being used as a testing hub because we don't have sufficient loopholes and regulatory hurdles to go through. So people create an intervention in X and then come to us to test it on us. And we're not really connecting the dots because as those innovations and digital health are being used, data is equally being extracted. And then another thing is the hub through which innovation is being tested. On one hand, you have regulatory sandboxes, and then you have certain countries that are using mechanisms like they call it trusted research environments and secure data environment. Basically, where regulatory hurdles, like you have gone through ethics approval, gone through committees, stating that what you're doing is ethically sound. You've gone through the required legal requirements, the GDPR. You've shown that patient has been involved. That's something I find very fascinating. So our governments do negotiations without health data, without engaging the public. So it's an afterthought, which is an absurdity, given that the data is not the government. So I think the crucial question to ask is whose data is it? Is it the government's data or is it an individual's data? And if it's an individual's data, can you make decisions on their behalf? So it'll be interesting to see in a couple of years some of the negotiations that have been done with health data, if it stands. Because if the data belongs to people and you made a decision on their own behalf without their own consent, not just consent, informed consent, then you're acting on your own accord. So basically, those secure data environments, depending on what they are called, enables you to have data within a confined space where researchers and innovators are able to do their testing and experimentation with data, but then that data is de-identified and pseudonymized in certain terms that you cannot tie it back to the patient or the individual that you're doing the experiment in, except maybe there is a huge emergency. For instance, you spot a cancer or something that is life-threatening. They have procedures for, getting back to the doctor and flagging that. So basically, what happens is people are able to do innovation, whatever data, using for artificial intelligence, training their models with the data in that environment, but they do not take the data out. The only thing they take out from the environment is the output, right? And you're hearing of data centers. A lot of the platforms we're using are foreign and they are collecting the data. Data is the new gold, is the new oil. So I think my point is that there are several layers that we are lacking, and that's why I would prefer that we focus on the low-hanging fruits that do not require a digital and data enterprise and architecture. Because if you're waiting for that to be in existence before you start moving, you keep on lagging behind. So while we work on those things, let's focus on the things that are not exceedingly dangerous or damning in terms of testing things on people without going through the right regulatory approvals, without doing the right thing just because you're trying to innovate. And also, another thing I will say is, just to wrap up my thoughts on this, is when you're innovating, depending on what your motive is, don't only think about innovating to get the stamp and approval of some external force or external entity. Let that not be all you're thinking about, because given the amount of rigor, time, and investment that goes into balancing these two things, the regulation that you go through, if your only goal is for you to create something so someone buys it for you from 1 million, that's right, you're in your own right. But given the challenges that we're having, it then means that most of the times you're allowing the funding pots to dictate what you innovate. And then later on, you complain that you can't scale. But the reason why you can't scale is because what you're innovating does not meet a need. So that's just it. So I think the way we're going, the Africa CDC, the African Union, there is a lot of working groups that have come together talking about harmonizing regional frameworks and guidelines and laws for medical devices classification. So we're taking the right step, but don't run faster than your shadow and go and do something that will eventually lead to legal liability down the line or something that is unethical down the line. So that's my thought on that.
Thank you so much, Marco. That was a really great overview and really in-depth touching a lot of things in terms of, engagement with the public, the ecosystem, the regulatory frameworks, as you mentioned. So thank you so much for that. I'll bring in Chris now in terms of in terms of the governance issues as well. What are the key things that you've seen, and what are the ways that we can mitigate that as well? And I'll ask you another question, quite a big one, cybersecurity. I think you mentioned that's a very, very big area, but what are the things that can be done to really mitigate kind of cyber attacks as we are seeing an increase of these?
Okay, thank you so much. And I think Amaka's done a great work in just laying down governance and the way to think about it. And so I'll just touch on that briefly. Two key things on governance, and then I'll talk about cyber. On the governance bit, I think is first of all, understanding what exactly is my solution doing or supposed to do, and how is it doing that? So is this solution supporting patients? Is this solution helping with diagnostics, medical records, etc.? So classify or identify the value that your solution is providing, and then you then work your way back to then say, okay, who are the regulatory bodies in this area that are connected to this issue that I need to, speak with or engage with, right? So, and the challenge with Africa is that we don't have a lot of these things clearly defined. So in the US, in the UK, what consists as a medical device, what consists as patient health, all of these things are well identified, but it may not be very obvious in your country, in the African context. So, but that's a good place to start. What exactly does my solution do? Who uses it? Who is going to be impacted? And so you then work your way to say, who are the regulatory bodies in that area that I need to speak with? And then, of course, data is universally applicable regardless of the type of innovation or digital solution. So you definitely want to get it right in terms of the governance principles around data, and make sure that you are abiding by data safety laws, your data is safely secured, you are protecting your data as you should, which leads into cyber. But before I talk about cyber, the other thing when we talk about governance is that as innovators, we don't like governance. We just like to sit in our nice little silos and think about the solutions, and you want to make sure the tech is working and all of that. But we need more innovators who are intentional about shaping the governance and the policies that influence them, right? And as someone who is working on the policy side, I see how a lot of decisions are being made at multilateral levels, and you scarcely have people who are at the front line, who are creating these solutions, who are engaging with the patients, having influence in those spaces. So it's very important that innovators in the room, that we're intentional of being part of those governance conversations. If, for example, there is no clear-cut law, there's no clear-cut guidance on maybe patient safety for digital solutions or digital models, be the person that champions that, right? Be the person that champions that. And to get into those conversations, you have to be visible and you have to be vocal, right? Those are the two things, right? If you're not a politician, that is, your impact, your the great impact you're doing within your community or within your space, which is very commendable, does not shape governance decisions. And I see this a lot every time I speak with private sector players, and I speak with them and they say, oh, our solution is doing this, we're covering this number of patients or this number of trusts. And then I ask them, okay, have you thought about putting out a policy output? Are you engaging with the government in any way? And oftentimes the answer is no, because as innovators by default, we have a tendency to be excited about innovation than think about the laws and the policies that govern us. And then you could go on with that, and then 3 years, 4 years down the line, the government has brought a new law, or the government, someone brings up a law and says, oh, you faulted on this, you faulted on that, and just like that, all that work can go down the drain. So the other part is just to challenge everyone on the call. If you're an innovator, you're a player in this space, be part of governance conversations, right? And that happens, of course, by connecting with people of influence, but by being vocal and visible about the work that you are doing, and also seeking out the spaces where you can shape these conversations, right? And if no one is talking about it, be the person to talk about it so that you can influence this. I think in Nigeria, maybe 2 or 3 years ago, we had the first national framework on digital health solutions, right? And there was a whole extensive consultation. This was during Buhari's time, when Buhari was the president, and that was like the first time that digital health innovators were coming together to discuss a policy or a law that would influence everyone in the space, right? And this is how many years into digital solutions being in the country. So just to encourage every one of us, be a part of governance conversations, seek out those opportunities, be vocal about what you need and what needs to change, so that you are ensuring you are creating that environment that enables you to thrive. Okay, so when we then talk about data, whenever you talk about digital, you talk about data, and when you talk about data, you talk about cybersecurity. I think cybersecurity remains one of the areas in the African continent where there are significant gaps, right? The cybersecurity framework is not holistically defined. As we see in other regions, and that is a challenge. One, because we see that fundamentally most of the data that is coming out of the continent is not stored within the continent, right? A lot of our health data is stored in other regions or other jurisdictions, and there's a question of what is being done with this data, who has access to it. The insights that are even being drawn from these data, is that coming back to the people from which the data was generated from? And Amaka was talking about ownership, data ownership, that fundamentally the data belongs to the people who created this. So there is significant room nationally, right, for countries to begin to think about data protection, and then on a continental level to establish guidelines that are applicable across countries to ensure that our data are secured, is not exploited, and is being used for the development of the health sector and the region, right? Globally, we are seeing a rise in cybersecurity attacks in healthcare. So it's not a far-fetched thing. Even in the UK, right, in the past 5 years, at least there have been two major national cyber attacks, and this is not even counting attacks that happen within trust that never make it to the news. If you Google online, you will see that the health sector has been on the rise in terms of cybersecurity attacks. So the question also comes, is that, are these attacks not happening on the continent, or is our system so porous that the attacks are happening and the hackers don't even have any opposition to getting access to that? So we need to think about security very importantly. And security is not just the passwords, right? No, when we think about security, it's like, oh, having a two-factor authentication and all of that. No, that's a part of it. But as an innovator, you are asking patients to come on your platform. Patients are signing up, or doctors or users or what have you. Where exactly is that data being stored, right? Which provider is helping you store that? Do you know what happens with that? What measures have you put in place to ensure that it's not being hacked? When you are building a cybersecurity framework, there are a couple of dimensions to think about, and I'm not going to go into all of them in there because this call can go on for a long time. But there are a couple of dimensions that make up cybersecurity, and one of that is risk management. So risk management is, do you have a framework to manage the risk of threat actors, right? The risk of cyber attacks to your solution. And what are those risks? So somebody hacking into your database, somebody posing to be a user, for example, and gaining access. Risk of wherever you are storing your data, is it safe enough? The risk of just different risks, people posing to be maybe your staff, right, getting access to the back end. So risk management means that you do a risk analysis of your digital architecture to say, okay, what are the loopholes and what am I going to do to block these loopholes, right? To do an effective risk management, you would want to bring in a cyber expert to look at your system and walk through the system with you to show you where the loopholes are and what you can do to block that. The other part of it is incident response, right? Incident response has to do with when an attack happens. So if your innovation gets attacked and somebody gets into your system, what do you do? What happens, right? And it means that you have to have a plan that in the event that there is an attack, How do you route your patients? Do you have backup systems? Are you able to switch to manual operations if needed? Do you have, data being backed up somewhere or duplicated somewhere that you can leverage on? What will be the length of the downtime? What will be the patient impact, especially if you're a patient-facing service? What mitigation steps do you have in place? For example, say you are a startup that is dealing with diagnostics and your system is attacked, and there's a cancer patient who was supposed to, go for chemo that in the afternoon, and maybe she came for test that morning. She wanted to do a full blood count just to see where her blood levels, what the parameters are, before she goes for chemotherapy. And then your system is attacked, and if she doesn't go for chemo, there's going to be deterioration. That is patient impact, right? So do you have a plan to make sure that in the event that things like that happen, you are mitigating that? That's what incident response has to do with. Has to do with what would you do in the first 12 hours, in the first 24 hours, in the first 48 hours, in 72 hours, in a week, and things like that. So that's instant response. There's the part, of course, of capacity building and training. So are you training your staff to be cyber aware? Do they know what phishing emails look like? Are they able to spot the signs of threats within their systems? How often, do they know how to do a good how to develop good passwords and securely access the systems? So that's what training and capacity has to do with. There's also dimension of the technology, right? What kind of technology do you use to deliver your service? A lot of people, I know that, of COVID, everybody was excited. Everybody was a developer. And you had startups that started with 3 people, one CTO who does the tech, one CFO who does the money, one COO who does operations, and a startup is founded. But nobody is asking, developer, what platform are you building this on? Who is running, where is this being run on? Is that platform secure, right? So you want to ensure that you are using the most up-to-date technology to deliver your service. Softwares are up to date, your licenses are up to date. You are not just taking anything that is open source, just looking for. And I know we talked a lot about innovation and working with what you have, but you have to ensure that you are delivering something that is secure and that will not cause you harm. If it's open source, if it's just available and anyone can access it, there's a high chance that it is porous, for cyber attacks. So there's also a dimension of thinking about that as well. So those are just some of the areas when you're looking at cyber security, that you want to ensure that you have covered. And then, of course, you want to find out what if there are national cybersecurity laws. You want to ensure that you are aligning with those as well. But as a continent and individually as innovators, we need to pay attention to these things. African data is being used, being taken. In fact, that's the reason why it's not making the news, because it's the access, the security is currently not at where it should be, and we need to ensure that this data is secure and it's not falling in the hands of threat actors or people who have malicious intent as well. All right, thank you.
Thank you so much, Chris. I feel like we barely scratched the surface in terms of cybersecurity and probably all these different things. I think we definitely need a part 2, maybe even a part 3. This is a huge topic. So thank you so much, Chris, for really kind of giving that great overview of cybersecurity and also the governance elements. So I think we'll be starting the Q&A very soon. So I put it in the chat. If people have start thinking about questions that you may have for the panelists, start by putting it in the chat. We will open the Q&A very soon. So I think we'll need to kind of wrap up. I wanted to kind of ask maybe 2 closing questions. And if you could both kind of very briefly, maybe in like 2 or 3 minutes potentially, if we can, what do you see as a kind of, I guess in the next 5 years, where do you see the African kind of digital health landscape? And also if you could kind of share one practical lesson for people in the digital health space, whether it's they're innovators, whether they're professionals working in the space, early career or maybe experienced. If there's any practical, like one practical lesson or one even takeaway from this session that they should kind of take away with them in terms of practically using in their day-to-day in their work, what would that be? So I guess the two questions, the future, what do you see as the future? And also the one practical lesson in just kind of a few minutes so we can give chance for people to ask their questions. I'll start with Amaka. Thanks.
Okay, so in 5 years' time, I just want to say categorically that digital health is here to stay because we're in the digital age and that would only keep on advancing. However, I envisage that the way digital health will play out in Africa in advancing our concerns, both from prevention, diagnosis to healthcare services, improving efficiency and access, will play probably differently from how other people are doing it, and that's fine. So it wouldn't be exactly how other people are doing it. And I just use examples like our entertainment industry, how Afrobeats progressed and came as a surprise, and the fashion industry. And so my first advice to people would be keep on putting the work. Okay, it doesn't have to happen. You don't need to be on LinkedIn or some websites as the top 5 innovator for it to mean that you're doing work, even if you're not visible or not being hailed. Just keep on putting in the work, keep on honing down to what the need is, and ensure that you're doing it responsibly. That's ensuring that it meets a need, you're meeting regulatory requirements. And the second thing I would say is for those who are still trying to figure out what to do within this space, I think the opportunities are endless. In governance, there are layers. There's the clinical safety. For instance, in UK, they're pumping in money to develop and train clinical safety officers. So as we're talking about that balance of innovation and governance, you need people to check that things are being done rightly. And then for the legal and policy framework, you need people. Public engagements, you need an ecosystem. So start thinking about how you can upskill yourself, and how you can be part of the work so that you're ready when the boom eventually happens, because it's going to happen. It's only a matter of time. So that's what I have to say.
Thank you. Thank you so much, Amaka, for sharing that. Great tips and great overview there. Chris, if you'd like to go next.
Okay, thank you. Where do I see the landscape in the next 5 years? I think we should expect early is not the word because it's not so early, but we should expect standout solutions, right? Um, we're already seeing, hubs of innovation across the continent in different countries. Of course, Nigeria is being spotlighted. We're seeing Kigali rising up as well. We're seeing similar as well in South Africa, a couple of countries in the north of Africa as well. So we should expect standout innovations that would sort of expand and be leaders, frontliners, and leaders across different regions on the continent. And that is good news because then they are creating a pathway and infrastructure that so many others can follow. So I expect to see that in the coming years. And who knows, some of those innovators are right here in this room or on this call as well. Also, is to say that in the next 5 years, the landscape would evolve, right? The landscape will evolve, will change. It should hopefully become easier and clearer as we have some of these champions become more prominent, what the pathway is to successfully scale innovation on the continent. The challenges that we're seeing now may not all be totally solved, but I think should become a bit more easier for those who are coming behind at that time to be able to say, oh, this is how to go about innovation on the continent. Message to everyone in the room is start from where you are, right? Start from where you are, start from what you have. Don't wait for all the chips to be aligned, right? Look at the problems that are affecting you directly. The most important or easiest problems to solve are the problems that you can relate to. And I believe that some of us are already doing that. I can see there are a lot of founders, on the call. So start from where you are and begin to build that ability and capacity from there. The other thing I want to say is that I know we've done a lot of juxtapositions, but learn from global standards, right? See what is happening across the world, but bring that information home and contextualize it, right? Bring that information home and contextualize it. Say, oh, this is what has been done in all of these spaces. How can I apply the fundamental principle to my own context and my own reality? And at the end of the day, it's that ingenuity that is coming from the continent and learnings from other parts of the world being mixed together to create something new and different that was unexpected. And once we solve the problems, the more we solve the problems in Africa, the more we're creating a template for the world to follow, because there are ways we'll solve older problems. Like we can solve old problems in new ways that nobody else expected. And like, oh, how did you do that? And that cost less. That was with simpler resources. We want to adopt that as well. So that opportunity still lies, and I will encourage everyone to leverage that, keep reiterating, and there's no the sky is just the starting point to what we can do.
I love that. Don't underestimate Africa. Yeah. So perfect. I think there were great tips there from the both of you. Upskilling, putting in the work, starting from where you are. And I think as a summary in terms of the other discussions that we were having, it's all about the local context, learning from other and the global spheres and other countries, but really how does that apply and how is that applicable to our local context? So understanding the real need and really creating and adding value. So thank you both. It's been a really interesting discussion. We'll open it up now. I think we have a few questions. So the first question, what parameters are in place to help young innovators safeguard their innovations from cyber attacks or piracy? Yeah, go ahead, Chris.
Yeah, I can take that. So I think the first thing is it depends on where you are. It starts first of all from your solution. So what kind of solution are you deploying? What does your solution demand? What is it providing? What kind of data do you collect, right? So a solution that is, for example, dealing with, I was giving the example of diagnostics. So you are getting patients information, you're providing them diagnostic solutions, will have a different kind of security parameters from a solution that is probably just sharing health information but not dealing directly with patients. So first, depends on the solution you have. Secondly, also depends on the region where your solution is located, right? Depending on the country, some African countries have national cybersecurity frameworks and guidelines. So that's always a good place to start. What is the national cyber guideline for my country? We did a review on this, but I'm not sure we found a lot of African countries that have health sector specific cybersecurity frameworks. So you may want to start from the general cybersecurity frameworks from your country. Then that's one part, to say what are those guidelines and ensure that at the very least your solution is abiding by the legal frameworks and laws that govern cybersecurity. The other side of it is that a lot of the innovation, like we've said on this call, a lot of the innovation solutions that we have on the continent use data platforms that are not based here. So you're using Gmail, for example, or Google to create your account, Google Forms or Google Solutions. All of that data is being stored on Google Cloud, or what's the parent company now? It's being stored on their own data frameworks, right? So to an extent, you are leveraging on the security that they have provided, right? Alphabet, yes, you are leveraging on the security that Alphabet's company has provided for their data broadly, right? So if you are using those platforms, and this is the same if you're using Slack, if you're using Zoho and what have you. So whatever platform you are using to deliver your service, store data, have meetings, calls, all the things, you are leveraging on their security architecture to keep your data secure. So you are not totally without any form of protection. It's just that the protection you are leveraging on is not within your direct remit or within the jurisdiction where you are located. So it's important that you also read those things, right? When you see all those long user agreements that we usually just skip, it's important you read them to say what exactly is happening with the data that I'm putting on this platform, and and ensure that they align with your needs. If there's anything you are not sure about and you're using a particular platform, we're having this call on Zoom now. So we are trusting on the security of Zoom of the Zoom company to ensure that the data and conversations that are being shared on this call are safe and secure. And if you have questions, reach out. You can reach out to those organizations to understand better how data is being managed and how things are, how it's being secure across board. And then I think, like I've mentioned before, on a continental level, there's still a lot of work to do. There are countries, sorry, let me just make this important point. There are countries where you cannot use a foreign owned solution within the country, right? So you go there, for example, in Mongolia, you can't use a Google whatever to store data. It just won't work. All their data is stored within the country because that is the regulation that the government has established. And that is understandable because they are surrounded by a lot of, countries who are interested in their data. They are surrounded by Russia, by China. And so that's how they keep their space cyber secure. So on the largest scale continentally, there's room for us as Africa to define how we ensure the security of data that is coming from the continent, what that should look like, and how that can strengthen innovators. So I hope that's helpful, and at least that gives you a place to start looking at these issues.
Perfect, Chris. Thank you so much for that. We've got a couple more questions. So let's just read that one. QU Zach Health has deployment-ready AI preventative health technology and has already successfully completed proof of concept deployments within African health systems, yet there is still no obvious pathway from a successful POC to adoption at scale. What should the ideal African pathway look like from validation and regulation through procurement to national deployment, and who needs to be at the table to make that happen? Okay, who'd like to take this one?
Yeah, I'm happy to start. So, firstly, I want to say well done with having done proof of concepts. However, I think at the start of this conversation, one thing I flagged is you can have an intervention that meets a need, but who would pay for it? So, on the other end of innovation is payment, health financing. And like I said, there are priority areas within Africa. And so, if you create something that is brilliant, meets a need, and there is no one to pay for it, you end up in this kind of dilemma. And then the second thing I'm seeing there is I think it's really interesting you framed it that way. It's not possible to have an ideal African pathway because even in countries that have advanced systems that are interoperable, have wide ecosystems linking health, life science, and innovation, they're still trying to figure it out. So I would say that what would be obtainable in some parts in Africa would not be obtainable. It's 54 countries. It's not one country. It's a continent. So it's hard to have a playbook that will work across. So I think if I use the example, now that I've stated the obvious, I just want to go back to something. Telehealth was something that was within the ecosystem, especially in the US, for years, and doctors resisted it. I think that this is something we haven't mentioned. Change management. You can have the most brilliant intervention, but if the people who are supposed to use it do not see it as a need, you've met one end, but you have another end to deal with. So telehealth was there. People kept on talking about it, had series of roundtables, had so many conferences. And then COVID-19 happened and people were forced to use it. So that's why when I made a statement about, things to look into, that whole future 5 years, I said sometimes what you're doing in the back end might not catch immediately, but provided you know you're doing something that addresses a need, in certain instances, time is all you need. Timing is all you need. And then what seems to be a thing that people are not willing to pay for becomes almost compulsory. So in the US, when the pandemic happened and hospitals could not bear for patients with different conditions to actually come to the hospital, they had no choice. They had to then use telehealth. And so those who had already invested in it earlier picked up really fast. For the ones that were resistant to it, they had to start picking things up. And so the point I'm trying to make is you can meet a need, but then who would pay for it? And it goes back to what I said initially. The Africa CDC, the African Union, has outlined their priority areas. So for now, one of their key priority areas is primary health care. So if you're able to link your intervention to a need that people are willing to pay for, then you've met the triangle. And it could also be, if it's not a case of you need systems and countries to pay, there are also interventions that are directly to consumers. So there are different ones directly to governments and to companies, and the ones that are directly to consumers. So there, you also have to think about who will pay for this. Yeah, so that's what I would say. So you just never know. You have that in place. You've done your own part. Proof of concept are really hard. I would say this in the UK. There's this very annoying thing. I can tell you this for free. There are a lot of creators and innovators that have gone through the hurdle, the regulatory requirements, the accreditation required. They've done proof of concept. And unfortunately, in the UK, how it happens is if you go to the East Midlands and test an intervention, innovation in a hospital, and you go to another hospital, they'll say you should start again because the population set is different and you can't really tell whether it's going to play out differently. So now that you've done the work and you have it in place, keep on doing the work, keep on talking to people. You just never know. Something might come up and move the tide. And the second thing is try and look at the priorities that have funding and see if there's an opportunity to connect what you're doing to it. So that's the two things I would say, if that's helpful.
Thank you. Thank you so much, Amaka. Okay, so we've got a couple more questions. We'll just be on for another few minutes, so I hope everyone can still stay on with us. So if you can briefly answer, how can we make informed consent truly understandable for patients rather than just forcing them to agree to long privacy policies?
Okay, let me take that. So some of the ways that have been helpful, not just even for patients, but in other sectors as well. So some of the privacy policies, or look at privacy policies in two parts. One is the commitment of the organization towards the user, and the other is the commitment of the user towards the organization, right? And so what I've seen, helpful ways I've seen is that you want to front load the commitment of the user towards the organization first, because as a user, that's what's most important to me. So that is, for example, you agree that your data will be stored or used for research purposes, right? I think that's a common one I've seen here. So you want to make sure that the things that the user is consenting to by using your service is at the top. And then your other promises, to the user, like we would, your data is stored confidentially, no interaction on this platform will be shared with a third party. If you have any challenges, we will refund you, whatever that you are promising as an organization comes second, right? So that's kind of the helpful way to do that. Let the patient see what they are committing to first, highlight those, and then the other bits of it can come second. What's the other part of the question? So I don't know if that helps. So, and then also depending on the bespokeness of the service, because there are certain innovations that are tailored for certain patient groups or user groups, right? You want to then, if you know there are key concerns for that user group, so for example, your service is supporting sickle cell patients, for example, right? And you say you're connecting them with practitioners, and you know that maybe there are a lot of conversations around, how they will get, treatment for pain medication, right? The risk of misuse or addiction and things like that. So you want to highlight those kind of unique consents straight up. So if, for example, you say we do not allocate pain medication for sickle cell patients, we do not recommend or provide prescription for pain medication patients without a confirmed consultation with a specialist. You know that's something important for these patients that you deal with. You want to highlight those kind of things right from the get-go. But a good practice is whatever the user is committing to, put that first, and your commitment should come next.
Thank you. Thank you for that, Chris. Another question we have is, we see everything being posted online and we often stress on patient confidentiality. When using telemedicine, how do we protect ourselves as practitioners?
let me chime in on this because there are a lot of security questions. That's fine. So, when you say protect yourself as a practitioner, um, you cannot absolutely rule out user behavior, right? In terms of you maybe somebody deciding to go put out false accusation against you or saying you said something or did something that you didn't do, right? But how the way you can ensure that if that becomes a legal case, you have the backing of the law is to ensure that right from the get-go, you are abiding by, we've talked about the governance laws, the privacy laws, the security laws. You want to ensure that you are following those procedures from the get-go. So consent, ensuring that patients are aware how their data are going to be stored, what you're going to do with their data, how the service is going to be, how the service is going to run, ensuring that you have all of those things in check so that if a false accusation is brought against you, social media or otherwise, you know you're on the right side of the law and you can challenge that legally. And if you are being falsely accused, that is a crime. You have the right to take that up legally, to call the patient out, to say you are defaming my character, it's a false allegation, and send them a warrant to desist from that as well. So the first thing, the chief protection is ensuring you're on the right side of the law and you're doing things right. And if those accusations come up, you can then leverage legal means to address them.
Thank you. Thank you for that, Chris. I think as we're slightly out of time, sadly, I know we can keep going with the questions. So thank you so much, everyone. We just have time, I think, for just one more question. And then hopefully you can connect with Amaka and Chris if they're happy to share their LinkedIn details. And then you can kind of carry on there. But we have just one last question. How can young innovators with resource constraints access valuable data to train their solutions?
That's a really interesting question. So that makes me feel like it's going to, that's what I'm saying. It's one of the things that I alluded to. In systems where there are structures in place, it's not like you go randomly to a hospital or you put out a survey. They're usually systems, so secure data environments, trusted research environments. You put in your application, it goes through series of review to ensure that your research, depending, there's a difference between research. Okay, and this is something I wanted to flag because I've seen some questions that are making me a bit uncomfortable. Something about innovating quickly. When it comes to health, is speed a concern, or doing things at pace and ensuring that what you're doing is safe for people? So I think speed and health interventions and digital health don't go hand in hand. So first of all, in accessing data, in systems that I'm aware of, they have like a data bank, a data repository, because again, I think I need to emphasize this as much as possible. The data doesn't belong to you, it belongs to the individual. Okay, so how they usually have it is some countries have something they call an opt-out policy, opt-in, opt-out. So when you go to the hospital, you sign a document that you're okay with your health data being used for research or for innovations and interventions. If you do not desire to do that, you opt out. Okay. So when you then opt in, it still goes through series of processes, ensuring that the consent that was provided is truly informed, that is done within the purview of what's acceptable to people. They have things like public engagement with the owners of this data, asking them questions. I know you agree to be part of this data bank, but are you comfortable for us to use this for artificial intelligence? Are you comfortable for us to do it for wearable research? But the way your question is phrased, I'm just wondering, is it like you walk up to a hospital and ask, can I get data to test something? So I don't know what the system is currently in Africa as a continent. That's what I think. Tread very carefully. Focus on the things that have systems in place, because I think your biggest fear, if there's anything that should motivate you and keep you awake, is two things: the possibility that your intervention eventually causes or endangers people, exposes them to harm, or use people's data in a way they're not supposed to use it. Two, litigation. If law cases don't keep you awake, I don't know. That should be something, because the worst thing that can happen to you is you have a huge innovation and then you spend years of your life going to court. It might not be hot cake now, but it will catch up. So my advice to you is look at your system. What is the regulation? What's the process for accessing data? Follow it through. Ensure that there is a layer of public engagement. Tick all the boxes. Ensure you're doing the right thing. Stop trying to speed things up. This is not, you're not creating a game. This is not a game app. This is for human beings. So follow the procedures. Ensure you get the required consent so that whatever you do stands the test of time. So that's what I would say. And I hope that the continent looks into data banks that have gone through all those required checks and then allows researchers and innovators to do that research without violating people's data privacy. That's possibly where we'll get to in a couple of years.
Thank you. Thank you so much, Amaka. And thank you, Chris. Sorry we couldn't answer all the questions. But unfortunately, it was a very, very interesting, insightful conversation with you both, Amaka and Chris. I wish we could kind of carry on. I know there's so many areas to touch on. I think just even one section, I think we discussed it before, that it's basically a master's dissertation. So it's a huge, huge topic. But I'm sure that we can, hopefully there'll be many more opportunities to kind of carry on the conversation. Just as a kind of wrap up, I think a few things. Governance, it's key to kind of engage in these conversations. What are the regulatory frameworks in terms of data protection, informed consent, upskilling, and what can you do with what you have? Context, understanding how it can really be applied to the African continent. I think we also talked a little bit about cybersecurity and all the key elements. So those are just a few of the things that we talked about today. So thank you again to our panelists, to Chris, Amaka for taking the time today. Thank you so much, Mike and Innovate Health Hub for organizing this panel. And thank you, of course, to our audience. Thank you for so many brilliant questions. And I hope you can connect with Amaka and Chris and kind of carry on the conversation. Don't let this be the end. And yes, we will kind of see you hopefully in the next Innovate Health Hub event. But really carry on and taking the words of wisdom from Amaka and Chris today in terms of all of the key messages. So carry on with your work and carry all these messages with you. So thank you everyone again, and hope to see you at another Innovate Health Hub event. Thank you, everyone.
Thank you all.